This is my second round of the Monster BBL with Dr. Sajan. I had really good results the first time, and he was the only doctor that I saw that did that specific mixture instead of just the normal Sculptra BBL that most people do. And him and his team worked really well with my insurance to get it covered for me. So that was a big factor in it as well.
How were the results the first time around?
They were great. Yeah, I loved them. I just wanted a little bit more definition and volume in my hips, so just to kind of focus on the little nooks and crannies.
All right, friend, thank you. So our plan today will be to do 40 vials, our second session of our non-surgical buttock augmentation, right? A version that I call the Monster Zombie BBL. So the plan will be to round out the hip dips, give you more shape, more projection. Sound good? So what I'll do is I'll do my measurements, and then Chance will put on numbing cream, and then we'll have you stand for a few moments. They'll go and make sure the OR is fully ready for you. Then they'll take you in the operating room, and they'll get everything ready, then we'll start. And when we start this, we start with, because we're doing strictly local, we're gonna start with a few syringes at a time. Make sure you're feeling okay with it, and let the numbing kick in. The reason we're going to do a couple at a time is because each syringe has numbing medicine in it. So it'll slowly get more numb as we do it. Sound good?
Sounds good.
Awesome. And your flight back is later tonight?
Tomorrow.
Oh, perfect. Do you have any questions before I do my measurements?
No.
Awesome. Great. I know we've increased the roundness. Are there what bothers you the most now?
If you could get some more projection, I guess, this way.
Yes,
right
I agree.
I want to focus more on like this area.
Absolutely.
That kind of hip shape.
Yes.
I'm pretty happy with the projection of my butt, but you know, as long as it doesn't look super unnatural or crazy, I'm not literally looking for a Kardashian, but just a little bit more like an hourglass.
Absolutely. Our goal is to make the dysphoria better and to really focus on this area. You're right. Good. So what I've done is I've marked the hip dip on each side with the centralmost portion. So now we'll put as much as we can here, but we'll also build and give you a little bit more projection, because all the 20 vials on each side won't all fit here. There'll just be too much pressure on your skin, but we'll build as much as we can.
Sounds good. Do you put any in the thigh area?
We can. Which thigh area stands out?
Just kind of like a little bit more out here to blend it. I
Sure.
mean, you're the doctor and you did a good job last time.
Thank you.
I trust your eye.
I know you do, thank you. The reason I would suggest we don't go too much lower than here is because this is the indentation.
Yeah.
If we build it on the bottom, the indentation will look deeper because you'll have a bigger convexity.
Okay.
Do you follow me? So what we'll do is we'll see how this pops out. If it pops out well, we'll feather it into this area, okay? Depending on how it how much release we get with the product. Awesome. All right, thank you. You're so kind. I'm so happy to do this for you.
Yes, thank you so much. I
My
appreciate
pleasure.
your help.
Thank you. My pleasure.
Quite cold, okay?
Okay.
Next, we're going to be doing the Monster Zombie non-surgical Brazilian butt lift. Now, the Monster Zombie non-surgical Brazilian butt lift is a procedure that I pioneered and developed. It's my procedure. Our goal is to use a non-surgical technique to grow the buttock. Why would we do this? Well, not everybody is a surgical candidate, and surgery isn't right for everybody. Our next patient does not have enough fatty tissue to do the procedure surgically. So in this case, we're going to be using an FDA-approved product that's not approved for the buttock, but it's approved for the face. We're going to be using it off-label in the buttock. We've reviewed this with the patient and we have consent. Now, when we do things in aesthetics, many times things can be off-label. Now, what does that mean? What that means is the product was approved for one use, but you're doing it in a different use. So our patient's goal is to remove the hip dips and make them rounder, build shape. Our patient flew in from out of state, and this is the second one she's undergoing. We're going to be meticulous in how we inject. We're going to create shape and form. When we do it, it's going to be much bigger than where we're going to end up. The way the products work is, when you initially put it in, it looks really big and full. Then it's going to go down a little bit, and then it'll come back. We'll have our final results in 8 weeks. Let's do it. Beautiful thing about doing surgery is when you understand the anatomy and the physiology, and you've seen it, you've touched it, you've manipulated it, you understand and know how to do non-surgical to another level. Non-surgical techniques are great and they can have a lot of value, but I feel you get true excellence, you get true changes in anatomy and physiology when you understand where things are, and not just understanding where they are, that's really important, but understanding how they move and how they work and how you can manipulate them with your hands. When you know how you can manipulate things with your hands, then when you have a needle, that is a non-surgical way of going about it, you're able to understand what limits you can push and what you can't push. Do I know anybody who's ever done 40 vials in someone? No. Have I done it before? Absolutely. Why do I know I can do it? And how do I know I can do it? I've seen the anatomy. I've manipulated the anatomy. I understand the physiology. And when you understand those things, that's when you're able to use a knife or a needle to achieve what the patient wants. Let's do it. All right. Thank you. Everything went super. I did 40 vials. Again, we didn't add the PRPA cell because of the risk of lumpiness. Okay. Things will go great. Hopefully this is all you need. If you want more, I'm always here.
Okay.
If you have any issues, you have my cell phone numbers on the paperwork. You can call me or text me anytime.
Okay. Thank you so much. I
Of course.
appreciate you.
Any questions?
No.
All right, you're so kind. Thanks for coming all this way.
Yeah, thank you for helping me out.
Of course. You know, we don't take it for granted that you're a repeat. We take it more seriously, and it's more onerous on us to deliver more and do more, okay?
Thank you.
Thank you.
Just slosh over that way
Yeah. Go ahead and turn it on.
like a zombie for the BBL. Oh, wow. Okay. Oh my God. That's crazy. Oh. Yeah, that'll go down. No, it looks good though. Yeah, if I could get like, because I know it's gonna go down and then build up again. That is insane. Wow. And he placed it like right where I needed it too. Perfect. Cool. Holy God. Yeah, that's great. Right. It'll look better when it settles and it's a little bit more natural.
Yeah.
It's always kind of funny to see like the dramatic like difference at first though. That is, I'm surprised that my skin can stretch that far, honestly. Thanks, Dr. Sajan.